welcome to another episode of the Healing Lyme Summit. I'm your host, Dr. Mariah Hinchy, and today we're going to be talking about RGCC testing for Lyme disease as well as SOT therapy. So, here to lead this discussion is Dr. Andrew Peterson. Dr. Peterson is a nationally recognized Lyme specialist, and he has been in practice for over 24 years and is the chief of staff for Forum Health. So, Dr. Peterson's approach is holistic and he treats environmental toxins, endocrine, autonomic, and electromagnetic dysfunction, as well as infections. He has dedicated his career to thinking outside of the box, and what he does goes way beyond conventional testing and treatment. And I am honored to have him here with us today. So, welcome, Dr. Peterson. Tell our listeners a little bit about yourself and how you came to specialize in treating Lyme disease.
You bet. And thank you, Mariah, for having me. So, yeah, I grew up the son of an Army officer in the United States Army, and so we moved all over. We lived lots of places growing up: Alabama, Maryland, Texas, Colorado, South Dakota. Um, I, uh, I, when I went to work as a physician, I worked in a really little tiny town in the Panhandle of Texas, and found that when you work in a small community, the town had 2,000 people. I was one of two doctors there. You see the patients everywhere. You see them in the grocery store and the football game and the line at the bank, and they, show you their rash and they ask all the questions no matter where they're at. And one of the things that's pretty apparent is that we aren't really helping people get better, right? We lived a long ways from a specialty, university clinic, right? We were 3 hours to Lubbock and 5 hours to Dallas and 3 hours to Oklahoma City. And so to convince one of these farmers to go see a specialist at Texas Tech or UT Southwestern was hard. And then when they came back, they were diagnosed with the exact same thing that you had told them they had. And maybe their treatment was a different brand of the same sort of medicine. So it became pretty clear that all we were doing was managing their symptoms. We weren't finding the cause of what was wrong. So that's, like I think many physicians, that's what started me on a journey to try to find out how do I help people actually be healthy as opposed to just give a name to their collection of symptoms and then manage it. Um, so I started on that journey and focused primarily, I would say, on hormones and nutrition and gut health initially, and said, oh, let's help people be healthy. And moved here to Utah because my wife's family lives here. And I saw a young man who had not been able to get out of bed for 18 months. His dad, asked me, hey, can you help him? And I didn't think I could, quite honestly. But I said, well, I'll do some tests. And he came in and he'd served a mission for his church in Madagascar. So we tested him for all sorts of stuff. And he'd already seen the infectious disease specialists, and he had already been treated with antibiotics for a period of time, I think 3 months. But he tested positive for all sorts of things. He tested positive for brucellosis. He tested positive for Bartonella. He tested positive for Lyme. He tested positive for all sorts of viruses. And I was way in over my head, but there are a lot of great mentors in the Lyme community, and I just learned from them. And the reality is I never intended to be a Lyme specialist, but once you're willing to take care of a patient that's chronically ill like that, then people are like, oh, he'll listen to me and help me. And so I couldn't avoid it at that point. The reality is I think you are called to do what you do by the people that are calling you, not because of yourself. So that was my experience. That's what led me to be a Lyme specialist. I served on the board at ILADS because of great people that I met there, like Dr. Horowitz or Dr. Burrascano, and being able to spend a little bit more time learning from them was a real benefit and a pleasure. And now, when patients come to see me, I have to sort of reorient them and say, look, I'm not a Lyme doctor. I'm actually an integrative, holistic physician that wants to make sure that you regain health. And one of the things that could be affecting you is this infection called Lyme, or any number of other infections, but it's not just infections either. So that's my
Right.
story.
That's great. That's fascinating. So yeah, it's hard. It's like once you treat somebody that has Lyme, or once you act as that medical detective that really helps them to figure out the underlying cause is, right? Because even when you have Lyme, that leads to a whole bunch of other underlying causes.
Right.
You start attracting all of these patients because, you get that reputation that you're going to actually figure out what's wrong with them. And therefore
Yeah.
then you know how to heal them.
Yeah. And so, I was a Lyme doctor until I became a mold doctor, and I was a mold doctor until I became a toxin doctor, right? And you're like, wait a minute, no, no, no.
Right.
I'm just a doctor that's trying to figure out the cause, and there's a bunch of causes. It's a soup. One ingredient is not, we might call it chicken soup, but that's not the only ingredient in the soup. So
Perfect analogy. Yep. It's like the tick soup, but
that's
and
right.
the environment.
That's right.
So tell us a little bit more about Forum Health.
Yeah, so Forum Health was formed 5 years ago now, and the this is another thing on sort of my journey of becoming an integrative physician. I joined A4M and did a fellowship, and what I would notice when I would go to A4M, that's the American Academy of Anti-Aging and Regenerative Medicine, I would go to their conferences, and purportedly they have 26,000 members at the time that I was attending. And I would talk to these other doctors that were in the same fellowship classes with me. And I'm like, well, where are you practicing? Oh, well, I work in California. Oh, what do you do? Well, I work for Kaiser Permanente. And I'm like, you're doing this fellowship and you're just doing regular medicine? Yeah, I just don't know. I mean, it's scary. I don't know where to start. And it was just so disheartening to me that it seemed like three-quarters of the people learning what we know aren't able to jump in with both feet and start doing it, right? Then there was the other aspect in my role at iLads. I would see that people built an island for themselves that was, and they didn't really build it, their patients built it, but that they were really sort of singular focus. They only did this one thing. And their patients would benefit from all sorts of other things, but because the patients were all coming for hyperbaric oxygen, that's what they offered. Or their patients were all coming for, like in my case, SOT, that's all they did. And so the idea of Forum Health was to help get these islands of care to be more of an archipelago, like all, maybe they're islands, but they're working together, and to get some of these people off the sidelines that know what we know and want to participate, but don't have the either the support or the courage or the just reckless abandon to say, I'm going to do this. So Forum Health now has 35 offices around the country, and growing. We've got two more of the offices that will probably close on in the next 2 months. We purchase offices from successful practitioners, and they continue to work with us. We also start offices de novo, and it's everything from hormone therapy to stem cells, from Lyme care to mold care, right? And what I think we're achieving is these people that are doing one thing are now able to offer all these different things at their office because they have the back end support from the business team and that sort of thing. So for the doctors themselves, it turns out to be very helpful because now they don't, we go to conferences and we come home and we're excited to offer a new service, but it just takes too long. It's distracting. And so, as a provider, I think you're a little disappointed because you'd like to do this new thing for your patients, but there's just no time to implement it or the sort of support to know how. So that's the idea behind Forum Health, and we're growing nicely. And I think the physicians, I'm the chief of staff for Forum, and so I work with the physicians a lot. I think the physicians are happy and excited about the things they can do now that they couldn't do before and the support that they get in this collegial environment of, if I don't know the answer, well, I'm going to call Wally Taylor, who's been a mold specialist in the Austin, Texas area for the last 35 years. He'll know, right? Or I'm going to call Steve Moress, who's been treating Lyme disease twice as long as I have, right? He'll know.
Right.
So
That's an amazing concept. That's great.
thanks. Yeah, it's going well.
Good. Good. So why don't we start out by tell our listeners why you think, why is Lyme such a controversial disease to diagnose and treat?
Right. Great question. And anybody listening, I'm sure, maybe knows these answers or at least knows parts of these answers. Things that always present the same, everybody has figured it out, right? If you get strep throat, it's not a mystery. And everybody that gets strep throat, or almost everybody that gets strep throat, presents with the same symptoms. They have a fever and a headache and maybe a stomach ache, and their throat hurts, right? And so we don't mess it up a lot. We're not unsure. Well, yeah, it seems like you test positive, but you don't have the symptoms, or you're um, you're you're not you're not following the path right, right? But with Lyme disease, it's not the case. Um, Not everybody that gets Lyme disease gets equally sick, not even close. In fact, I would estimate that probably a third to half the population would test positive if we just tested them at random. They might not have very much of the bacteria, but they have some, and they're totally fine. Now, when they got it, they might have had some symptoms. They might have had some inflammation as a consequence, and they were a little achy, just like after someone gets Epstein-Barr. They felt a little crummy after they contracted Epstein-Barr, but they don't have chronic Epstein-Barr now that they're 30 or 40, that it hasn't bothered them again. Lyme can be that way. And so I think that makes it difficult for the conventional approach to say, yeah, chronic Lyme is real. Um, the other part of that, the counterpoint to that, is that just because you have Lyme and you don't have any severe debilitating symptoms doesn't mean it's causing you no symptoms. And I would say, in fact, that's where SOT can be valuable for some patients that are relatively healthy, but not as healthy as they'd like to be. If you have a microbe living in your body that creates inflammation, it's going to cause issues, right? If it doesn't cause big issues, that's great. But if it causes little issues that, 15 or 20 years down the road, you're more achy or you don't feel as sharp mentally, well, get rid of the microbe, right? And so I think it's just because we confuse normal aging and we just say, well, that's normal to have arthritis at age 56. It's just osteoarthritis. And we ignore it with disease, or we say that's not disease. And to some extent, if the disease isn't always the same, then we can't agree that it's a disease. So chronic Lyme is just one of those scenarios where it doesn't affect everyone the same. Your genetics has a fair amount to do with how sick will it make you. Your immune reactivity has an enormous amount to how sick will it make you. How much your immune system either controls the population or doesn't has something to do with how sick it makes you. Where it decides to live in your body, and therefore you might have joint pain versus brain fog versus insomnia. And so it's difficult in that respect. As far as testing goes, the example I like to use with my patients is it's like looking for a needle in a haystack. This is not unique to Lyme. If you're trying to identify how much hay there is in a haystack, that's not an impossible task. It's a question of how accurately you did that, right? Did I count every piece of hay? Did I weigh it by the ounce or the ton or the pound? And so that's sort of like checking what my sodium level is, right? If the lab is inaccurate, it's not because I had zero sodium or I had sodium. It's just, did it find that my sodium was 142 or 145, right? But looking for something that I shouldn't have, like I'm not actually supposed to have Borrelia burgdorferi floating around inside of me, there's very little of it to begin with. And so finding needles in haystacks is tricky. And you can use different methods to do that, right? If I used an electron magnet to find the needles in the haystack, it would work better than sorting through it one piece at a time. But what if the needles were made out of bone instead of out of steel? Well, the electromagnet would fail, right? And so sensitivity, did my test catch what I was looking for, is a different thing than specificity. Did the positive test accurately reflect that I do have it? And that balance between those two things is difficult. And so scientists, people that work at universities and are just doing research, they're always coming up with new ways to find stuff. And they have come up with much better ways to find things. But then we are also falling back on this concept of insurance-based care is always going to provide the latest and greatest, which is clearly not true. You could prove that just by saying, does insurance cover a genetic test like 23andMe? And the answer is no, but it is the best genetic test you could do, and it's not that expensive, but you got to pay for it, right? Your insurance would be more likely to pay individually for your MTHFR and your COMT, and then they're going to spend more money because they're not in the business of doing science. They're in the business of doing business, right? So there's just so many reasons why this is hard, and it's politically motivated to some extent, and it's just somewhat about not intentional, but ignorance to some extent, and so it's a
Yeah,
mess.
it's really unfortunate because it's the patients that end up really getting worked over the most and confused and suffering and often told that they're crazy and, families falling apart and it's just terrible. So
Yes, the
we
lack of understanding in that respect, I don't think that conventional medicine intentionally marginalizes these patients because I practiced that way for 10 years. I remember taking care of a cowboy in Texas who would come in and had chronic prostate infections, and I would treat him with doxycycline, and he would feel like his prostate infection would get better after about 6 or 8 weeks. But then he would say to me, "Oh, doc, can I stay on this? When I take it, I'm not as achy. Like I feel so much better." And for whatever reason, I can work longer. I mean, this was a real cowboy. That's what he did professionally. Is he rode a horse and went around and moved cattle for a rancher. I guarantee you he had Lyme disease, but I had no idea, right? And
Right.
so every single time when he was done with his 6 weeks and his prostate didn't hurt as much, right? And he's riding in a saddle every day. I'm like, no, we can't keep you on doxy because it's bad for your gut. And so this poor guy, I'm not trying to marginalize him, but he didn't get his Lyme treated because I didn't know anything about it. And he's asking, can I stay on it? And I'm trying to do the right thing and not hurt him, right? So,
Right.
it's not, it's partly out of ignorance. It's partly, out of arrogance. There's all these reasons.
Yeah. No, and I try to tell my patients too, like, doctors aren't maliciously not learning about Lyme. We learn what we're taught in our universities. And then typically there's a family member or a friend or a patient or something, right, that forces us to learn more about Lyme and tick-borne disease and in environmental medicine.
Yeah.
But so we've talked during other interviews here as part of the summit about various methods with testing, right? So we've talked about direct, we've talked about indirect. From the indirect, we've looked at antibody response like IgG, IgM. We've talked about T cell response. We're going to talk about a different method of testing, RGCC. So can you tell the listeners exactly like what this method of testing is and how it would differ from these other methods?
Yeah, good question. And actually, RGCC, they do own a lab called BioCentaur, and it's a PCR lab, and it's not a different sort of method of testing. It's just PCR testing.
Okay.
What RGCC does as a lab is not primarily testing. Their primary focus is on making a therapy called oligonucleotide therapy. And so, in order for them to do that most efficiently, you're already going to do another test. Okay, so if I have a Lyme patient and they come in and they're like, I want to do this oligonucleotide therapy, this SOT therapy or SOT therapy, um, I'm going to test them with a test from IGeneX or from Vibrant America or from DNA Connections or from T Labs or from whatever lab, right? Galaxy. It doesn't matter the lab I use as long as it's a reputable lab. The reason that I need a test to be done already is because they're going to do PCR amplification for the specific microbe, the genus and the species of the microbe that we found. Okay, so for example, if I do a Vibrant America test, which is they do antibody on PCR testing, and I don't have a preference for that lab. I like to think of it as the Honda Ridgeline of Lyme testing because it tries to do everything. It doesn't do anything perfectly. Okay, my dad has a Ridgeline. I have a Dodge. My truck is more of a truck, but his truck is more of a truck and a van and a sedan, right? So it sort of sucks at everything, but it does everything okay. So don't take this as an endorsement or a criticism. It's the test I do. And the reason I do it is because it tests for 30 different things,
Right.
right? And then I can say, oh, this patient has Borrelia afzelii, and they have Borrelia burgdorferi, and they have Borrelia miyamotoi, and they have Bartonella henselae and Vinsonii, right? And we'll start with that. And then we'll say, okay, they have these 5 things. Of these 5 things, these 2 are the worst, right? The miyamotoi and the Bartonella vinsonii. Now, if I send the patient's blood to RGCC and I have to send them a positive test and then I say, this is the one I want you to make. Okay, now they can put in the start codons for the specific thing and they can amplify the DNA for that microbe and then they can make what's called an oligonucleotide, which is essentially a piece of mRNA that's got esters on either side. So it's going to silence that particular gene that they found in that particular microbe. Okay.
Okay, so let
Uh,
me interrupt and ask one question. So it does not matter if the patient gets a positive PCR or not, just having an antibody response that is positive and knowing what species of what organism is enough to then have the SOT made.
that's right. That's
Okay.
exactly right. What's important as far as testing goes is that they have either an antibody or a PCR test. It could be serum, it could be urine. Um, and I actually have had our GCC accept a lab that was I think T Labs does some sort of an immunofluorescence assay. Um, they've taken that too,
Okay.
right? What they have to do, because part of the process of making the SOT or validating that the SOT would work, is they're doing their own PCR amplification. Okay, and when they do their own PCR amplification, they can do it more efficiently knowing what they're looking for. Does that make sense?
Yeah.
Okay, because they can put in just the right start codons. So now, even if there's not that much of the DNA, they haven't their likelihood of amplifying what they're looking for goes up. So now they found the thing. Then they're going to compare the DNA because there are unique genes that are only found in any one of these species. And so they find a unique gene that is also not found in humans, and then they can silence that gene. And if they silence that gene, well, then every time the microbe replicates, it actually can't finish the job, and so it dies. Because, bacterial replication, you've got this DNA, it opens up, it starts to replicate on this end, it starts to replicate on that end. Now you've got two pieces of DNA. The DNA migrates apart, the bacteria tears in half. Now you've got two bacteria, right? That's how Lyme makes babies, or Bartonella makes babies, right?
Right.
So when it does that, the oligonucleotide molecule simply grabs onto the gene that it has targeted. Now replication can't occur. And it can't go back together and it can't finish the job, and so it dies.
Awesome.
Yeah,
So how effective is this, let's say, for Borrelia living in a biofilm? Like, can it get past it, or is this a case where you would have to use various agents to help to break down the biofilm and expose, the bacteria to these agents?
right. That's a great question and one that patients ask all the time. So the limitations um, that occur for antibiotics are still the same limitations for SOT with that respect. Like if the microbe doesn't replicate, it won't die. If the microbe is in some place where the SOT molecule doesn't get to, it won't die. And that would be like a biofilm, right? So
Yeah.
it's helpful to make sure that like if you let's say you had an abscess that the SOT didn't go to. Well, there you go. So that's why you got to see your biological dentist still. But think about this. An oligonucleotide is 19 base pairs long. That's how long they make them. It's got an ester on either side. This is one of the smallest molecules you can imagine, right? In a cell, inside the nucleus, you've got 23 chromosomes of DNA, and we're talking about 19 base pairs of that. So that's proportionally how small it is. Dramatically smaller than the bacteria. So you don't have to worry about, well, will it cross the blood-brain barrier?
I
Is
was
it going to
just
go
gonna
here or
ask you
there?
that. So it
Yeah,
will pass the blood-brain
yeah,
barrier.
it's going to go to all the tiny places. Um, but it still has to, it can't, well, let me phrase it this way. It can go to all the tiny places, but it still has to be carried there somehow, right? So just like oxygen goes from the mom to the baby through the placenta, this would have to go from my circulation to my brain the same way that, all the nutrients go into my cerebrospinal fluid. So it's not being actively transported by anything other than what would actively transport these little tiny pieces of DNA, of mRNA, right? But it can get there because of its size. That's not a problem. Um, Biofilm does matter. It's probably a good idea to do something for biofilm ahead of time. And I've treated probably over 500 patients with SOT, and the effectiveness is exceptionally high, but it's not perfect, right? And that's anytime you have a new therapy that's really promising, like disulfiram, I used it a lot back when it first came out. I still use it quite a bit. It's still a great therapy, but it doesn't work for everybody. And I would say SOT is in the same, like it's just like everything else. It works amazing, but not perfect. And that's a limitation as biofilm.
Right. So, yeah, I mean, I don't think that there is one thing that works for everybody, right? Different things work for different people depending on what infections, what co-infections, what opportunistic
Yeah,
infections, what else has been broken down, the state of their immune system, all of
for
that
sure.
stuff.
Yeah, as far as SOT goes in that respect, what I would say my experience has been is people oftentimes don't realize all the things that they have. They did a test, maybe they did, you know, what is it called, an immunospot with IGeneX or something, and they know they have Lyme because that's all they looked for,
Right.
right? They spent $400 and that's what they found. They don't know that they also have Babesia otocolii, and there's not very many labs that test for that. And so, how would we know to treat for it? And
Right.
so, when I see patients that did SOT and they didn't get better, I don't have any doubt that the SOT worked for the thing that we targeted. I actually have doubt that they probably have a whole bunch of other stuff that we didn't treat.
Right. So can you use SOT simultaneously for multiple infections, or would you go after each one of them at a time?
So you don't want to treat a bunch of things all with one infusion because each SOT is genetically targeting one microbe, okay?
Okay.
And you are going to have a Herxheimer reaction just like you would if you took antibiotics or herbs or whatever, right?
Mhm.
The Herxheimer reaction is more uh, protracted. It takes more time for it to occur, and it's not as severe. And that's because this is not a great analogy, but if I was trying to eliminate humans from the world, I could shoot them, right? But that would probably attract attention. People would say, hey, there's a problem, right? I could put birth control in the water instead. I'd make a lot more progress that way and people would not notice it, right?
Right.
That's what's happening with this SOT is you're preventing replication, but you're not actively killing. And so the number of Lyme funerals happening in your body is the same as it was going to be anyway the next day and the day after that and the day after that, right? It just fractionally becomes less and less and less. The SOT molecule floats around doing its job for 6 months. So you do have a Herxheimer reaction, but it's not as severe and it probably is just this mild thing that goes on for several weeks, right? So to answer your question, you can do an SOT for Bartonella, and then a week later do one for Babesia, and then a week later do one from Lyme, and then a week later do one for Ehrlichia. But you want to wait at least a week in between each one. And when patients come in and I see them, I explain that to them, and then I say to them, but you might not want to do your second SOT at 7 days. You might want to wait 2 or 3 weeks, and we're going to find out on day 6, you're going to tell me, right? Because you can always reschedule coming in to get your infusion. But there's no reason to get your next infusion if you're still herxing from the one that you just got. Does that make
Right.
sense?
It totally does. And I have this conversation a lot with patients and with other practitioners that I'm training because, we all think of a herx as, oh, it's a temporary exacerbation of symptoms. But I don't think people really realize that when somebody is herxing, their inflammatory cytokines are kind of going through the roof and you're increasing cell damage and you're
Right.
increasing acidity and you're actually damaging tissues and
Yep.
you're actually indirectly helping that infection live in the
Right.
body, right?
Yep.
So yeah, I think it's super important to try to mitigate and deal with herxes instead of just piling more and more and more on and saying, "Hey, just get through it."
Yeah, that's
A
exactly right. The way I explain that to my patients is, look, there's the inflammatory cascade is actually helping, but only to a certain extent. And at a certain point now it's causing harm to you, right? You want it to cause harm, but you want it to cause harm to the bugs and not harm to you, right? And so you can't be a hero and push through this. You have to cause you have to allow just enough harm to occur that the bugs are injured and not you. So it's like running a marathon, right? Like you have to pace yourself, and maybe at mile 7 you actually walk for, you know, 200 yards. That's okay. You're still finishing your marathon, right?
Yeah.
You're not winning an Olympic medal, but you'll get to the finish line.
So do you do a lot of prep work with your patients? Like we spend, a decent amount of time trying to deal with people's guts, because obviously if you have impaired tight junctions and you're leaking all of the toxins back in, your herxes are going to be way more severe because you cannot detox. Do you do other things to help to prep your patients and do you use binders and things like that when you're using SOT?
Yeah, absolutely. Uh, I guess that goes back to the holistic nature of what we have to do to really get people healthy. The things that I describe to patients is the reason that we're sick, there's sort of four environmental stresses that make us sick. There's microbes, there's toxins, there's electromagnetic frequencies, and there's trauma slash stress. And we got to address all of them. And it's an all four, all the time approach to getting you better. And so while the SOT is only addressing your microbe, we gotta, and when I talk about these four things, your gut modulates or mediates all of them, right? It's where the bugs live primarily, like your microbiome. It's where you detoxify because we poop out a lot more than we sweat out or pee out. Thank goodness, because otherwise we would stink more when we sweat. Um, our our autonomic nervous system is mediated by the gut, right? That's where the enteric nervous system tells the vagal nerve to tell the brain whether we're in fight or flight. So it's all connected there. So yeah, I use lots of Immuno-G from Inwell. I use lots of transfer factor from Research Nutritionals. I love Thanabiotic, which helps the microbiome. It's a fecal transplant, right? This is not an advertisement for any of those things, but if people are listening, just go online and get them because they will make a difference. Cleaning up the toxins, fixing the tight junctions, critically important. The other thing that I would say that I believe is every bit as much part of your Herx reaction as the die off and you've got to clean up this mess is that when a microbe dies, it doesn't disappear. It's just dead. And it's floating around dead. And your immune system has a lot easier time seeing floating around dead stuff than hiding active alive stuff. And so your immune system upregulates. And a lot of the immune cascade, the inflammation of autoimmunity gets worse. And that's part of the Herxheimer reaction too. So things like your naltrexone or low-dose immunotherapy. Like if I can put a patient on low-dose immunotherapy and see good improvement before I do their SOT, fantastic. Because now when I do their SOT, not only will their Herx less, but they're going to recover long-term far better because their immune system says, I can handle this. So.
Right, that makes sense. Okay, so are there instances? So, what I'm understanding is that this is kind of a one treatment per species, or do you sometimes have to do repeated treatments?
Yeah, unfortunately, sometimes you have to repeat a treatment. For bacteria, that's unusual, but it's
Okay.
not impossible. And that's because bacteria love to replicate. I love little analogies because patients understand them. Bacteria are like rabbits. If they just had babies, they're having them again and then again and then again, right? They don't stop. There's no family planning for rabbits or bacteria. They're just going to divide all the time. And so if you've got an SOT molecule floating around for 6 months, it's probably going to kill all the bacteria. If it didn't, it's because of something like biofilm or maybe an abscess, something like that. There was some amount that it didn't get to, but it's unlikely that it was because it didn't divide. Now, while that's broadly true, what if I have a round body form of Lyme that's not replicating, right? Well, it's not going to kill that, okay? So that's the limitation with bacteria. With viruses, on the other hand, well, viruses are more like people somehow. They start having kids and then they stop. And then they start again and then they stop. And so if your Epstein-Barr isn't active right now, the SOT is not going to kill it. And so the effectiveness is slightly lower for viruses than for bacteria with respect to one and done. There's plenty of patients that I've treated for Epstein-Barr, and I'll do a treatment, and then 6 months later I'll do another, and then 6 months later I'll do a third. And that actually, in my experience, I have better results than if I just say, we'll treat it once. Because I may have killed 60% of it with the first treatment, but I'm unlikely to have killed 100% or 95%, right? That's another, I think, area that we could debate as clinicians, and scientists would certainly weigh in with a different perspective too. Do we kill 100% of a microbe? Or do we just kill a fraction of it that is high enough fraction that it now is irrelevant? I don't think mathematically it's possible that we kill 100% of very much of what we're trying to eliminate.
Yeah,
So
I'd agree with that. And I think in the end, really, it's your immune system, right? Your
that's
immune
right.
system has to be recovered enough and functioning normally so that it can stop these things from replicating and kind of hold them in remission, I guess is
That's
the
right.
word I use with my patients.
Yeah, yeah, and people want to believe when I say it's up to your immune system, they want to believe that okay, well that means that at some point we stop killing it and my immune system will kill the rest. And even that I think is a misguided understanding. Your immune system will keep the rest in check
Right.
so long as you're alive. Right? Because as the bacteria go up, the antibodies go up. and then the bacteria go down and the antibodies go down. And so there's this homeostasis. And so that's why you can get chicken pox. I mean, you don't get chicken pox, but you get shingles when you're 48. You didn't re-catch the virus, you had it the whole time, right?
Right.
But most of us that still have the virus will never get shingles because our immune system is keeping it in check, not getting it all the way to zero, right? And so having people understand what healthy is or what a cure is important because they think of a cure as being zero bugs when really a cure is everything works and you're not taking medicines, right? That's how I say it to them. If you don't need any more meds and everything's functioning, then you're cured. And
Yeah.
remission, see the problem with I don't use the term remission because it makes them feel like it's a ticking, like it could come back. And
Yeah.
it could. So I like to reassure them that yes, it could come back, but you could also get hit by a bus or struck by lightning. I mean, statistical possibilities are endless. You could also, if you buy a ticket, win Powerball, but I wouldn't count on it,
Yeah.
right? So,
Yeah, I try to tell patients, I'm like, okay, like, as far as a cure goes, I don't know. To me, I'm like, a cure, you would have to be able to prove that it's 100% gone.
right,
And so
yeah, it's
that's
all
why,
semantics.
yeah, well, exactly. But I don't want to
Remission is more
mislead
honest.
people.
Yeah,
Yes.
remission is more clear because, but what they want to know is, am I well and be like other people? And that the
Right.
answer to that is yes. So,
I totally agree. And yeah, I think that's so dependent on recovering the immune system. So, how much do one of these treatments cost? Like the whole, like, obviously not your initial testing because it
right,
varies widely depending on the lab that you use. But once you've sent it off and you're having the preparation done and then you're getting it back and then you're actually going through the SOT therapy. Like how much would one session for one organism be?
right. Great question. So for the first organism, and I should mention, not that this is super relevant to these patients, but SOT was originally, RGCC, the lab that makes these SOTs, originally focused on SOT for cancer. Okay.
Mhm.
And so you can do it for one cancer or for one infection. And the first treatment, no matter what you pick to treat, is $2,700 is what we charge. And each one after that is $2,100. Um, the testing, to see the doctor, that just depends on the doctor. That's what we charge. We have to pay the lab for what's happening. I know that there are physicians around the country that charge more because I see patients that come here because they found someone that was more expensive. I'm sure there are physicians that charge less. Um, and for cancer, you're going to need to do it every 6 months because the cancer isn't constantly replicating. What you're doing for cancer is essentially you're preventing it so that when you are in remission, so you treat cancer either surgically with chemo or with radiation, and now we can't find the cancer anymore, so we're done treating you and we tell you you're in remission. Now we can give you SOT every 6 months to assure that when it starts to replicate and you would become metastatic and reoccurred, that doesn't happen, right? With Lyme or tick-borne infections or viruses, with cancer, it's basically $2,100 every 6 months. With these infections, it's a matter of saying, well, I got to clean up six things. Okay, well, let's stage it. What do we want to clean up first? We're going to clean up, and in the order that we go, it has a lot to do with the co-infections. Bartonella and Babesia are going to sort of spiral out of control if we just treat Lyme. So we treat Bartonella first, and then Babesia second, and then Lyme third, and then I move over to viruses and maybe treat Epstein-Barr, cytomegalovirus, or herpes type 6 next, right? And so then you're staging it, and patients will spend maybe $7,000 to do the first three, and then we wait and see, okay, do we even need to treat the viruses? Because
Right.
maybe we don't, right? Because your immune system recovered sufficiently.
Yeah, I think a lot of times the viruses are there as opportunistic.
That's right. I think they are primarily opportunistic, and so rarely do I have to treat the viruses. But when I do, we take that step when we've already taken care of the other things.
Very, very cool. So why do you think that this treatment in particular is, I mean, clearly this is what you do, right? So you must think that this is one of the best ways to go to deal with these infections. So
I do.
why is that?
Yeah. Well, I would say probably more from clinical experience than anything else. I mean, I've followed the ILADS protocols for antibiotics and definitely had some success, but I didn't have as much success as I thought I should. In fact, I probably didn't have success in even 50% of the patients with respect to truly getting them to that point of remission or, I would say like a physiological cure. They're better, we're done.
Yeah.
Um, the same thing, probably more so, would be said for herbs because patients just aren't that patient.
Yeah.
Um, it takes a long time and they just stay on those things indefinitely. And that's fine. If they're better and they're like, look, I'm going to just keep taking my cat's claw and my artemisinin, great. But you've been taking it for 20 years. Um, I use IV ozone. I use high dose IV vitamin C. I use UV light. I've taken people to Lyme, Mexico, and had them do the plasmapheresis. Every single one of those things helps. My favorite antibiotic is disulfiram, but I would say 20% of people can't take it and 40% of people really struggle, right? And there's plenty of people that I've taken care of that have they're on 50 milligrams of disulfiram daily for 3 or 4 years before they finally feel good enough, right? Because they couldn't tolerate more. And I've just found that SOT, so the like let's answer the question. SOT causes less of a herx than everything else I've tried. SOT seems to work better as long as I hit every problem than everything else I've tried, right? I know I can treat Borrelia burgdorferi pretty well with disulfiram, but it's not going to do a great job for Babesia, and it's not going to do anything for Bartonella. And so what do I do there? I put them on, rifampin for the next 8 months along with clindamycin, or I put them on herbs for a year, or I have them come in and do ozone. It ends up being less expensive for them to do SOT than to come to my office and do ozone, 4 times a week or 3 times a week for 3 months.
I
So
would
that's
also, I mean, from the little bit of understanding that I have at this point, regarding it, it seems like it also wouldn't have really any of the side effects that using long-term combination antibiotics would have, or even, single
yeah,
antibiotics, because
100%.
you're
Yeah,
not affecting the microbiome, you're not causing dysbiosis, you're not
that's
increasing, organ inflammation, all of the things, C.
yeah.
diff,
No, that's
candida, fungal
it's
bodies.
yeah, it's embarrassing to have not recommended to pointed that out. And it makes perfect sense to me that someone who you're a naturopath thinks about that as what matters the most for our health, which it is. That's the real thing. Instead of treating the problem, let's make them healthy. It doesn't mess that up, right? Because
Right.
I had lots of patients that I treated during the first, 12 years of my Lyme career with antibiotics, and then instead I got them better, right?
Mhm.
I mentioned that kid at the very beginning that was my first
Yep.
Lyme patient. I probably spent 5 years trying to get his gut better after I fixed his Lyme, right? Like
Right.
that was a long process to fix the mess I made. And with SOT, you don't make that mess. So that's probably the single greatest thing is that you aren't having to then treat their yeast for the rest of their life
Right.
or
Yeah.
put them on
I
a fecal transplant.
yeah.
So,
I think for me, like, one of my biggest aha moments in my career was that when I realized that, like, you couldn't, I'll still use the word remission. You couldn't get someone's Lyme into remission and be able to get them off their treatment if you didn't fix the immune system. And, like,
yeah,
how on earth are you supposed to fix the immune system if you are actively killing, the healthy good bacteria and causing dysbiosis, right? It's like you can't recover the immune system without a healthy microbiome, right? Like 70% at least of the immune system is in the gut and dependent on our microbiome, right?
totally.
So that was like a huge thing for me, and that is when, at that point I had been doing like integrative, like having, an MD doing triple antibiotic therapy along with doing all of the herbs and all of the functional medicine stuff. And, it was kind of like, wait a minute, why is this group of patients that I have that were only doing functional medicine and herbs able to get into remission and get off their treatment? Whereas, like, I had patients rounding year 3, year 4, year 5 on this integrative treatment, And then like something would happen, liver enzymes would go up, they couldn't stay on the antibiotics or whatever, and someone would transition over to like this herb only group. And then I was learning more and more about the microbiome and the immune system, and I was like, oh my god, like this is why. Like when you
Right.
take a Z pack for strep throat, it doesn't take your bacterial load to zero, it just shrinks it to the load that that particular person, their immune system can handle, and then the immune system takes care of the rest of it. So like when we look at, for example, Borrelia, and we look at how it breaks the immune system and how it can no longer act as a sniper, and it's more like the plane flying overhead like dropping bombs, and you're like, oh, huh, if I can't get it back into sniper mode, it's
Yep.
never going to be able to hold this infection in remission. And like I can't get it back to sniper mode without like fixing the gut, and I can't fix the gut while I'm on antibiotics. So SOT actually sounds like a perfect solution to that.
Yeah, it is. And I want it to be one and done, and lots of times it is. But if I have to do an SOT, again for Lyme or for Babesia, I still didn't mess up I didn't mess up their gut again,
Right.
right?
Yeah.
Um, and herbs are powerful, and it's funny. We want it to be both ways. We want them to be gentle and powerful. Well, they are sometimes gentle and powerful, but if I stay on the same herb for long enough, I can have some changes in my microbiome. It's the same as eating the
Absolutely.
same food all the time. If all I eat is blueberries and yogurt, well, guess what's going to grow? The bugs that like blueberries and yogurt,
Yep.
right? And so if you're constantly battling it, no matter what you're using to constantly battle it, you're going to have to chase your tail a little bit with your microbiome and your immune system. So to a large extent, SOT avoids that problem. I think there's a lot more to learn about SOT with respect to, well, is it, did we treat them one time and now 6 years later they're still good? I don't know. I've only used this treatment for 3.5 years, so I can't speak to that.
I was just going to ask you how many years you've been
Yeah.
doing this.
So,
So
that's the
three and
beauty
a
of
half.
science is it's all about questions. 3.5, yeah.
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 Do
So
you have any sort of statistics? Like, do you know roughly what percent effective
I mean,
SOT
I
is?
could give you an estimate from my clinical experience. I can, in fact, RGCC, and they've done some clinical trials, and their experience with Lyme, 95% clinical improvement, and with viruses, 70% or 75% have clinical improvement. But what does that mean,
Well, I
right?
was
Like
just going to
I'm a
say, I
little
don't like
better,
that term.
right? Exactly. So I didn't like it either, and so I don't really use that to quote to patients and say, we've got a 95% chance of being improved. Well, yeah, but I don't want to, improved is not my goal. I want to
Right.
be better, right?
Yeah. Right.
Um, from my clinical experience, I would say it's hard to put a number on it. I can give you anecdotes of patients that are entirely in remission, totally well, and there's lots of them. And then I can give you anecdotes of patients that are, I definitely am improved. I felt so good, but then 4 months later, I started to have symptoms return, right? It goes both ways. I have almost never had patients that have said it did nothing. Okay. So I find it to be easily as effective as everything else I've ever used, from ozone to herbs.
Yep.
Um, but I couldn't give you a number. I'm not enough of a scientist. I'm more of a clinician, so I'm not keeping the data.
Yeah.
I will say that's another reason why we formed Forum Health, is because I think the data is important. I'm just too um, unorganized or undisciplined to record it.
Yeah. People ask me the same thing all the time. I'm like, I have no idea. You know, I don't know. I don't have time. I'm busy treating patients. I don't have time
Right.
to run the
Yeah.
numbers.
And the scientists, the pure scientists out there are frustrated by people like us that
Yeah.
didn't write it down and didn't like stratify the whole thing. But well, those scientists aren't clinicians. That's my opinion.
Yeah. I'm like, some scientists can come along and pour through the charts and figure
Yeah.
it out.
Yeah. And at
But
Forum Health, for what it's worth, we're all on this same software, and the software is pulling the data, and we have a data lake. And maybe I'll be able to give you an answer in 2 years when the data lake has had enough data crunched to say, oh, look, here's the answer.
right.
So yeah, maybe I can give you the answer, but I'm not keeping track. My software is.
Yeah. So I just had a thought. Now, do you or does anyone combine like SOT with antibiotics? Would that be contraindicated? Are there people
But
doing
you
it?
wouldn't
Is
want to do
there
them at the same time.
okay,
Like if you gave them at the same time, it could be counterproductive because I want the bacteria. I
to
don't think that they
replicate?
think or have feelings, but I want
Yeah.
it to know the coast is clear and make babies,
Okay.
right? So you don't want to be taking antibiotics unnecessarily while you did your SOT. But let me use this example because patients they always invariably someone's going to run into this. I got my SOT for Lyme, and then I got a urinary tract infection, or I got a sinus infection, or I got bronchitis. What do I do?
Right.
Well, you take your 10 days of antibiotics, you treat it.
Right.
Because the SOT is working for 6 months. And taking your antibiotics for 10 days is not going to make all your spirochetes suddenly go into round body forms and it didn't work,
Right.
right? It's not black and white like that. This is biology. These things are alive, right? And
Yeah.
so can you take an antibiotic while you got an SOT? Yes, but try not to do it if you don't need to. That's
Right.
true of every time you take an antibiotic, right?
Right. And for the patients that like to like double dip and see all these various doctors at once, I mean, it sounds to me like doing antibiotic therapy for these infections are counterproductive because you're
Yes,
encouraging persister cell or
that's
cyst
yeah.
formation, which is going to make the SOT not work.
That's exactly right. So
Okay.
you don't want to do antibiotics while you're doing this and try to kill it both ways.
Right.
It will make
Right.
the SOT less effective.
Okay. Great.
And the same thing is true for antivirals, right? Like acyclovir and valcyclovir work by making it so the virus can't attach and therefore dump the information into the cell and replicate. Well, that would make the SOT not work too.
Hmm.
And the
So
same
you've,
thing is probably true in herbs to some extent, right? I
yeah,
couldn't tell you the mechanism of every herbal antimicrobial, but you don't want to be taking them and discouraging replication.
right. No, that makes sense.
But you
And
could do something like a Myers cocktail that might increase cellular health, but wouldn't have a dramatic impact on cell death. Does that make sense?
yeah, no, it
Yeah.
does. So when it comes to viruses, you can treat any virus with this, or is it really just the herpes family
No,
viruses?
I don't have them all memorized. I thought you might ask that. So I have the list of things. Now, they have to make an SOT molecule, which means that the scientists have to identify a unique sequence, a gene sequence that doesn't exist in humans but does exist in this microbe. So that's not always possible. They've been working on an SOT for parvovirus for over a year now and still haven't made one, which is discouraging to me because I have patients with parvo that that mimics Lyme quite a bit, and I can't treat it with SO2 yet, and I don't have another better treatment. But
Right.
here are the SOTs for viruses that exist: herpes type 1, herpes type 2, herpes type 6, cytomegalovirus, Coxsackie virus, varicella zoster, Epstein-Barr, human papillomavirus 16 and 18, human papillomavirus 6 and 8, hepatitis B, hepatitis C, HIV, and human T cell lymphotropic virus. So there's a lot of choices. The menu is long, but it's
And
not 100%.
yeah, and if you're going to treat viruses, so I would imagine like with HSV2, like you would be better off if you could time it, like giving the treatment when the person has an outbreak, or
Yes.
if it's Epstein-Barr, if they have an early antigen that's coming back positive, right? Like something showing you that
Right.
it's
That's exactly true.
okay.
Here's one thing, and this might be controversial to the scientists listening because I have no proof for this. It's just an anecdote. I've been shocked by a few patients that I've treated their Lyme, I've treated their co-infections, I've treated Epstein-Barr. They're better, but they're not all the way well. And they'll have this lingering fatigue and headache. Now their joint pain's gone and and the only thing they have left is herpes type 1. And I've done this more than a handful of times, probably 5 or 6 times. I treat their herpes type 1, and I saw this just the other day with herpes type 6. It didn't surprise me as much. But oh my heavens, they have the worst herpes that they've had of any of their SOTs, and then their symptoms finally improve. It has shocked me to see clinically that it appears that herpes type 1 does not just cause oral herpes viruses. I now believe, with no proof besides this, so don't beat me up over this, that the herpes type 1, I think, also can create central nervous system inflammation and be part of their fatigue and their headaches and their cognitive dysfunction. So I've just seen it enough times clinically that it means something to me. So
Yeah. I mean, judging from what all of the other herpes family viruses can cause systemically, yeah, I mean, it's not that
Probably
surprising,
not a
right? I don't
surprise
think
to
it's
you,
that
but
far of
I've
a
always thought,
stretch.
okay, herpes type 1, 2, and 3 are peripheral, right? Like oral, genital,
Yep.
shingles. And then
Yep.
herpes type 4, 5, 6, 7, those are central. That's just what I sort of thought, but I was wrong. I
Yeah.
still think that generally it's true, but I think that there's more to it. So,
Yeah.
I will tell you, you didn't ask this, but I will tell you that for the tick-borne infections, they have SOTs for Anaplasma, Rickettsia, Ehrlichia. Let's see, 6 kinds of Babesia, 6 kinds of Bartonella, and 19 kinds of Borrelia.
Wow.
So not everything is on the list. Let's see. I can't think of a common one that's not on the list. Like I don't think I've ever treated Borrelia finlandiensis because Vibrant America doesn't test for it, so I've never found
Right.
it.
Right.
But I've treated a lot of things I didn't know they would have had if all I had done was a Western blot, because how would I
Oh,
have known
yeah.
that they had Borrelia bisetiae or
Right.
Borrelia californiensis?
Right. It's great. So, anything
Well,
else that you want the listeners to know about what you do or about SOT before we end our interview?
I mean, I would say this to every listener. Your disease is more complicated than this, just the one bacteria that you first were identified as having. And integrative holistic care is what will get you all the way better. And so SOT might be a great step for your recovery, but it won't be the whole thing. And that I can't say that with enough certainty. Like I want to reassure you as a patient that this is a process. Your immune system is what matters the most, right? Not the bug that they found. Killing the bug that they found will make a difference, I promise. But the immune system will make the long-term difference. So don't miss the forest for the tree, the one tree you identified. Um, I think SOT is great. I don't think it's the only treatment out there that's effective, and I don't use it exclusively. In fact, most of my patients, I go through the entire menu of herbs, antibiotics, oxidative therapies, UV light, oligonucleotide therapies, right? All of these things will kill microbes. And we do want to kill some microbes, but we also want to help your immune system. And whether that's naltrexone, it's got to include gut health, low dose immunotherapy, they're all steps that matter. Um, I guess the one parting thought that I would give, because I don't think it gets enough attention, is the autonomic nervous system. A third of my patients don't get better because they have autonomic dysfunction, right? And if their trauma might be that they were sick for 20 years, fine, let's address that. If their trauma was they were molested as a kid, fine, let's address that. But we don't give enough attention to that part of our health because we want to separate our emotional health from our physical health. And that's a huge mistake. So if that's what's happening in your care, own your care and take care of your emotional health. You can't, I don't think you can take care of your emotional health on your own any more than you can take care of your Lyme disease on your own, but don't let that go neglected. So,
Yeah, I agree. It's such an important point that, our heads are connected to our bodies, right? And like our brain, if it's giving you a headache, right? Like I mean, everything's important, your cognition, your emotions, and
yeah,
especially with these infections, like of course we've talked about in other interviews, but it's like, these infections all cause massive emotional behavioral issues. I mean, some, yes, just from the sheer fact that you have been sick for 20 years and fighting, for your life and your body and whatnot. But also, a lot of these infections, they really just like your brain's on fire, right? And so you're dealing with the chronic illness piece that's depressing and anxiety causing, but you're also dealing with like depression and anxiety because it's messing with the different centers of your brain and your ability to make neurotransmitters and all of these other things. And, it's so important to deal with that, but also to balance the autonomic nervous system and get out of
right,
this chronic fight, flight, or freeze,
exactly.
right? So that our immune again, it all goes, like you said, back to the immune system because your immune system can't function properly if you are in sympathetic overdrive.
Yeah. I would say as big a breakthrough as disulfiram was for me or SOT was for me and my patients, ketamine assisted psychotherapy is right up there, right? Stellate ganglion blocks, right up there. So The autonomic nervous system, if it thinks you're dying, it can't let you get well. It has to help you escape.
Right.
So anyway, I appreciate that you also see the significance of that. And I do think as physicians primarily, we don't give that enough attention. It seems like too soft of science. And so we're uncomfortable talking about it because we can't we there's it's harder to cite a study. And since we don't want to be the one, voice in the wilderness saying something that's a little weird, no one says it at all. And therefore it's not conventional enough because no doctors are saying it. It's just a therapist, right? Or it's a health coach.
Right.
Well, the health coaches and therapists are right, so let's listen to them.
Yeah. Yeah. It's like it's the huge elephant in the room.
Yeah,
So thank you so much, Dr. Peterson. This has been a really great experience for me, and I'm sure for our listeners too. Tell our listeners how they can find you if they would like to become a patient.
well, that's a great question. I would say go to forumhealth.com. Forumhealth.com has all of our offices. I have one of those offices. Well, actually, I have two: West Jordan, Utah, and Orem, Utah. But I'm not the only Forum Health doctor that does SOT therapy. And so if you just go to forumhealth.com, you can find the closest office to where you're at. And like I say, we have offices in 35 different locations. We do work across locations too. Like if I'm not licensed in the state where you live, well, you could see one of the doctors that is licensed in the state where you live, and I could still then be referred to, and you could come out and do treatment with me. So, forumhealth.com.
Great. Wonderful. Thank you so much. And thank you to all of our listeners for being here with us. I hope that this information was helpful and helps you on your journey to healing Lyme. And we'll see you next time. Bye.